What's up, you guys? My name is Miguel, fellow Xray Tech Peep here, giving you the knowledge. So today we're covering NICU. This is more for students slash techs who are more newer in the degree or field. I would say for NICU, for the most part, you do go in there portable. They have, since I am a night tech, and I've also done daytime. During the nighttime, they will release, once again, all this depending on your facility. They'll have the morning ports for NICUs. They have certain times they'll want you to go in there at a certain time in the morning. I think it's like 5 a.m., 8 a.m. It all depends. Because, that's usually when they'll get the babies up, doing more moving them or doing some stuff. So some of them will kind of want it at around a certain time, which sometimes you can do it, other times you kind of do it whenever you're doing ports and it lands. I will say, being in there with NICU, you go in with your portable, everything, well, at least in ours, is kind of tight, closely fitted, and since they are, for those who don't know, NICU is like when the babies are born either premature or just barely born and they're like in intense care. They may have tubes, they have some sort of condition that causes them to be in there. When you go in there, you have to go and wash your hands, make sure they're clean, and like beforehand, you have to take usually a little PD, tiny X-ray cassette. That's what usually you use. And make sure it's clean. Make sure you sterilize it. We'll just wipe it down with the wipes before you go in there. Make sure your hands are clean and everything, and then you go usually to the little incubator that they're at. For the most part, from where I've been, it's either you do a chest X-ray, abdomen, or a babygram. So for the most part, that's what they order. Everything, you have to be very careful because with the machines and adjusting everything, because usually they have IV poles and all that. Most of the time they have a little slot underneath the actual baby table that you can slide in your cassette and you can position everything. And for the most part, from where I'm at, the nurses will hold the baby depending on, if they're moving a lot and squirming a lot, they'll hold and take little precautions and shoot. For the most part, they're very helpful to getting stuff done, and then depending who's there, we'll look at it, and if they have to adjust or depending on what the exam's for. And you have to be careful when they order babies and they're twins. You have to be very careful on that, because usually it'll be the same last name. And some cases they'll names, if they're a boy and girl, some moms will the only difference between the male name and the female name is like A, or I don't know, it's weird. The way they order it, it'll be both last names, and you have to make sure when you put it so the rad doesn't get confused. You have to put twin A, twin B. That's something to keep an eye out on your technique. Because certain portables, if you pull it up, it'll automatically set the technique for a normal patient. So you have to watch out before you shoot. Use the PD dose. And that's really about it. And yeah, see you in the next one.